Welcome to the Violence in the Occupational Therapy Workplace project. We want to give you a little bit of background about the project before you start working through the module's units. My name is Carrie Brown. I'm one of the developers of the project, as well as Annette Rivard, and you'll hear her voice as you go through the different units in the module. The project was sponsored with funding from the Occupational Health and Safety Innovation and Engagement Grant Program. This funding came from the Alberta government, and I am aligned with the University of Alberta. So, welcome. What are we actually going to offer you on this website? Well, the website contains an online professional development module. It's focused on identifying and addressing violence in the occupational therapy workplace. There's 7 units in all, and there's handouts that go along with each of them. There's also a section on resources, so to give you more in-depth information about some of the topics that come up and to point you towards resources that you may need depending on your specific context. Also, there's a downloadable continuing professional development certificate that you can receive upon completion of the post-test. It's a short post-test you can click on at the end of the units of the module and answer the questions, and that will take you to the certificate. So, a little bit about how we developed the background materials. First, we did quite an extensive background survey, primarily including occupational therapists in Alberta, but we fanned it out across Canada and also into the United States. And I'll give you a little bit of background information about that in a minute. We also carried out key informant interviews to get some more contextual data, and an extensive literature search was carried out. Then we pilot tested the whole module. So that survey that I mentioned to you, I just want to flag up a couple of things. Most of the people, well, about half were from Alberta. Um, Another quarter were in Canada, but outside of Alberta, and then about 30% of people were outside of Canada. So it was a fairly broad representation of occupational therapists and occupational therapy students. So in total, 283 people participated till the end of the survey. As you can see in this slide, a quarter of the people were under 29, then about another quarter under the age of 39, and after that, the remaining of the population. But interestingly, there were still a number of participants in the 60 plus age range. So here's a couple of fairly busy slides. I'll just hit the high points for you. 90% of the people who participated in the survey interacted with patients or clients. 78% of them had routine physical contact with patients or clients. 15% of OTs worked alone. 36% worked with 1 to 5 others, and 31% worked with 10 or more other occupational therapists. So there was a significant number of people who actually worked alone. You see staff, students, managers, people with no contact, and a few people with academics and some other positions that were held. The majority of people, 44% of them, worked in physical medicine. We had, unfortunately, not as strong a representation of mental health as we would have liked. Same with children and with community agencies. The people who did respond, a quarter of them worked with infants and children, then a significant number with adolescents, and then the majority of the participants also worked with adults or older adults. Now, this reflects there were some participants who worked with more than one population, so those numbers don't add up to 100%. They're far in excess of that. And then when we asked people, are you worried about violence in the workplace? About a third were not worried at all. And then moving up sequentially until we had, over 20%, close to 25% were worried and very worried. One of the questions on the survey asked, in the last 12 months, have you been attacked in your workplace? Now, there's lots of different types of of violence in the workplace, and you'll learn more about that as you work through the module. But the 4 categories, physical, verbal, bullying, and mobbing, and sexual harassment, these were the findings from our participants. Almost 18% said they'd been attacked. 90% said by a patient or a family. This is for physical violence. 20% of them were injured, and 8% required treatment. Interestingly, though, when we asked people if they'd ever witnessed physical violence, 30% of them said yes, and 10% of the participants said on a weekly basis. Then we asked people about verbal violence. Close to 38% felt they'd been the victim of verbal violence. Concerningly, 7.5% of them said all of the time. 37% also said that the violence was perpetrated by a coworker or manager. And what people did as a result of the violence, 6% of them transferred or quit. And then a fair number did not report. 60% of them felt it would be useless. Of the people who did not report, 60% said, well, it was because it would be useless, nothing would happen. Another 24% said that they were worried about the consequences, so they chose not to report. And then in much smaller numbers, some people identified that they felt ashamed or that they felt guilty. We asked people about mobbing and bullying. 19% of the people said they had experienced it, and 7.5% said all of the time in their workplaces. 90%, now this is quite different now from the physical violence, right? 90% felt that or said that the violence was perpetrated by a coworker or manager. Again, people did not always choose to report. 71% of those who did not report said it would be useless. 64% said they were concerned about consequences. And again, we had lesser numbers in the other categories, but people who said that they felt ashamed, 21%. The last category was sexual harassment. 8% of the participants said that they'd experienced sexual harassment, and 6% of those said it was all of the time. They said it was primarily perpetrated by patients and family members, and to a smaller degree, about a quarter, said it was a coworker or manager. Again, people did not always choose to report, 66% because they thought it would be useless, 34% because they were concerned about the consequences. So we see a bit of a different pattern here, and it appears that actually bullying and mobbing and verbal violence are more prevalent in occupational therapy workplaces. So that's a very brief snapshot to start us off on the module here. So basically what we know. Violence in the workplace is believed to be on the rise despite evidence of significant underreporting. Reasons cited by the healthcare professionals for not reporting violence include the stigma attached to being a victim, as well as shame, self-blame, and the fear of repercussions from coworkers of further violence. Sustained exposure to violence in the workplace, including aggression, abuse, and bullying, can have serious physical and psychological consequences, causing occupational therapists to leave their positions and even the profession. Violence in the workplace also results in decreased patient safety and compromised patient outcomes. So what's next? The 7 units in this module provide detailed information about violence in the healthcare workplace. It includes a clear definition, a description of the factors that increase the risk of violence, and realistic actions and resources that can be used to prevent and manage wide-ranging forms of workplace violence.